Rotator cuff is actually 4 muscles around the shoulder that help to allow you to reach your arm out to the side and then rotate your arm. Rotator cuff problems are a spectrum of injuries, anywhere from impingement and bursitis to partial tearing all the way to a complete tear where the tendon pulls off of the bone. Most of the injuries occur in the tendon part of the muscle rather than in the muscle itself. The rotator cuff can be injured in a couple of different ways. Most of the injuries are overuse injuries, and they're basically wear and tear over time. So we see that in the older population as people get into their 50s, 60s, 70s, they'll start to have pain in the shoulder. It doesn't come on suddenly. It's not an acute episode. It just starts to hurt over time that gets worse. And then there's the more acute traumatic ones after a fall on the shoulder. If somebody dislocates the shoulder, the muscle can actually pull off of the bone. It is a fairly common injury in overhead athletes. So in our baseball players, our swimmers, volleyball players, people that do a lot of overhead motion and activities will run into more problems with rotator cuff pathology. Most of the people complain of pain reaching overhead and sleeping on the shoulder at night. Even if you don't sleep on the affected shoulder, it can be quite painful and frequently wake you up in the middle of the night. But the definitive way to look at a tear is to do an MRI, which will show us the muscles and the soft tissues. Surgery is very rarely the first option. Usually we'll try other modalities such as anti-inflammatories. Physical therapy is very key in addressing rotator cuff issues. And in fact, if there's just impingement or a partial tear, those treatments will work 90 to 95% of the time. It's very rare that we have to do surgery for a partial tear. If you have an acute injury where you fall on the shoulder on an outstretched arm, lift something heavy and feel a pop in the shoulder, then most of the time those have to be taken to surgery to reattach the rotator cuff so that you can get that to heal and allow them to start working on strengthening. We certainly want to try non-operative measures first, work on a fairly intensive physical therapy with some of the anti-inflammatories, and then if the pain persists or you have weakness or loss of function, then surgery is a good way to repair that tendon and get you to where you have function back in that shoulder. When we repair a rotator cuff tear, what we're trying to do is reattach the tendon back to the bone. I have people ask me all the time, will this heal if I don't have surgery? And the short answer is no. When the tendon is pulled away from the bone, there's no way for it to reattach if there's a complete tear. That doesn't necessarily mean you have to fix it, but if you have failed the conservative treatment options that were not involving therapy, then yes, we can go in most of the time arthroscopically. Sometimes it requires an open procedure where we split the deltoid, but usually we can go in with the scope and reattach the tendon back down to the bone, allow that to heal, and then start with the physical therapy regimen over the course of about 3 to 6 months, and you can get full function and return back to that shoulder.